Healthcare is always a matter of concern for any country. So, making affordable healthcare available to every individual is a commendable job. So, in this, some companies, specifically startups, are making incredible work with new ideas and concepts. Hello, and welcome to Eastern Brothers. In this particular podcast, we sit down with a trailblazing entrepreneur who is doing incredible work in the field of affordable healthcare services. The company is known as Medilane Healthcare. It's founded by Dr. Dayanand P. Meitei. Let's welcome Dr. Dayanand P. Meitei. So we have Dayanand P. Meitei, a founding member of Medilane Healthcare, one of the leading startup company from the state of Manipur, one of the leading startup from the state from the region of Northeast as well, and doing a lot of work in this particular field of providing free ambulance services, or you can say ambulance services as a for the healthcare in the healthcare sector. And apart from that, the company is also involved in the field of providing uh, healthcare card to the patients across the state of Manipur, which is known as Medilane Healthcare card, just to curb the medical bills of the patients, which is a very commendable job. And apart from this, I think the company is also involved in the field of medical tourism, which is also a growing market in the state, in the region itself. So we'll discuss with him with entire business opportunities as well as the highs and lows about his business, and of course his vision, what he wants to take, what he wants to do with his company, and which areas or the region he wants to cover in the near future. So we have with us Mr. Dr. Dayanand. Let's discuss with him regarding his future endeavor as well as his journey. So, Dr. Dayanand, are you a practicing doctor?
Yeah, before starting, so I would like to thank Eastern Brother and Vishwanath, especially for this initiative and promoting and showcasing us in your podcast. And I would like to thank each one of the listeners in today's podcast. Yes, I started this, we started Medilane in the year 2016 and we registered in the year 2017. And at that time, I was a medical student. I was as a third year of my MBBS in Jennings, Manipur. I started my first company, and starting as a student, as a medical student, it's a lot of challenges. I have to attend a lot of classes and night duties and rounds and lectures and everything. But in spite of that, there's an inner desire inside because I want to do something, but I don't know what to do. I want to do something beyond my medical practice, and but I don't know what exactly I have to do. So most of my services started with what needed for my family. Yes, and I'll brief about how I start Medilane, and then we can go for further.
Sure.
So one fine day, my father need to shift from my hospital to another hospital, and at the time it was around say 2016, 17 at the time.
Right.
And so finding an ambulance is not that easy at the time. We have to go to the medical superintendent. We have to request that, and but it's not that easy. Other part of the country, they can get an ambulance by just a call. So I feel that why not this service is available for the state?
Right.
So then instead of complaining, I feel that why should not I start this? So with that intention, we start ambulance service.
It's just like a
during
stimuli.
Yes, stimulate me. So during my second year of MBBS, I started ambulance service, and but at the time, only one ambulance is there. We have one of my doctor friend who has an ambulance and not in use. So I asked him, why can we do a renting? Because I don't have money at all. I'm a student there. And I don't have the money to start a business. So this is how I started ambulance services. And in the meantime, so we started home nursing care, as you said, like healthcare card. So initially we call this as a healthcare benefit card, and we transformed to Medilane Health Card, and now we are rebranding to India Health Card. This is how I started my journey in brief. Yes.
Right. So as you mentioned that a certain incident in your life triggered you to venture into the business of providing ambulance services. So when you started ambulance services, because see, end of the day you are doing entrepreneur work, right? So you're not you are doing something beyond your medical job, beyond your medical thing, medical
Mhm.
job
Yeah,
to
practices. Yeah.
in practice into the field of
Uh,
entrepreneurship. So when you entered this particular business, what was the reaction of
mhm,
the family? Because you told some probably you have
mhm,
asked you said something to maybe to your parents, father, mother, or your family members that I'm going to
mhm,
start a medical services, sorry, healthcare
mhm,
services like this. So what was the
mhm.
reaction of those people at the time?
Actually, I don't never thought that I will be starting an entrepreneurial journey, but I just want to solve a problem. That's what I started. I never thought that I will be starting a company or entrepreneurship journey, but I thought that I want to do the ambulance services. My family members, they support me actually, but
Right.
initially, like my mother, they don't think that the business will be scaled in that way, and they think that is like doing something for the society. But they feel that my son is went for becoming a doctor,
Mm.
and he is
Right.
now, even my localities, they said that I am just like quitting my MBBS, and I'm like a say what people can call is like a truck owner. So he
Right.
has many
Right.
trucks, and so like
Right.
this, they feel in that way. But I know what we are doing, and it's
Mm.
helping people, and
Mm.
that's why we continue. Yes, there are some resistance from the like
Right.
localities, friends, and family, and some people encourage me. Some people also discourage me.
Yes.
But
Yes.
yes, I love what I do, and I still
Yes.
continue.
Okay.
Thank
Great.
you.
It's wonderful. So you mentioned regarding the services your Medilane is providing as of now. One is the
Mhm,
ambulance service. Other is the health card. So
mhm,
what is the means? Let's start with the first with the ambulance service. So this
mhm.
ambulance service is chargeable or is it free? What is the mechanism for this?
Okay. Okay. So we have two model. One is called free ambulance. One is called chargeable. For example, any road accident across the Manipur, we
Mhm.
provide for free ambulance. And this is from
Okay.
day one inception for the road accident. Any accident we provide for free. And we ship to the nearest government facility. This is our like
Mhm.
policy. And
Mhm.
for other like non-emergency, like transfer from one hospital to another, we charge a very nominal amount, and this is
Right.
chargeable. And we used
Mhm.
to transfer the patient from Imphal to Guwahati very often because of this crisis in Manipur. We are
Okay.
not yet, continue that service. Otherwise, we have like shifting from one hospital to another hospital to service across the
Mhm.
Northeast. And
Mhm.
we help many patients shifting from poor medical emergency, from transferring from one state to another. This is what we do.
Right.
Yeah.
So you do interstate ambulance services then, right?
Yes,
So
yes, yes, we
is
do.
it because as you know, as I'm informed that in Manipur the crisis some
Mhm,
crisis is going on in this situation,
mhm,
how do you transfer the patients from Imphal to Guwahati? Because I think road services are
yeah.
already closed. So
Mhm.
are doing through the airlift or something like that? Airlift.
So, what normally right now, you also understand that, and here because of this conflict,
Mhm.
there's a lot of restriction for the movement for the particular like community. So
Right.
as of now, we belong to that community. We cannot
Okay.
like move that from that particular area. But
Mhm.
there are another community like people. We help them to transfer the
Okay.
patient from Imphal to Guwahati. Yeah,
Okay.
they transfer the patient, and
Mhm.
as of now, we are not doing that. Yeah,
Okay.
because of the
Means as
crisis.
of now, you have some restriction while doing the services.
Yes,
So
yes,
you're
yes, yes,
confined to some specific location right now. Okay.
yes, yes. We are now
And
confined to, yeah, Imphal. Yeah.
regarding the just I just want to this question if you don't mind. What is the
Mhm.
normally nominal charge you charge for providing air ambulance services to the within the state within the region if you're providing services?
Yes, air ambulance is not within the state. This is beyond the state. Like, for example, Imphal to Guwahati, Delhi,
Okay.
Mumbai, Kolkata. Yeah.
Right.
So normally air ambulance is two types. One is called like we can call as two. One is called a stretcher model, where this
Mhm.
is like a say normal like flight. We book a few stretchers, a few seat, and we make this in a transportation for the patient. And another is like a charter flight. This is a
Sure.
particular like we can call as air ambulance.
Mhm.
Uh, patient with emergency doctors and paramedic along with that. So the
Right.
charges varies. and it depends on the times of availability of the flight, and you know, sometimes the flight rush is there, election time the prices shoot up, and you know, the price is is a ranging. We cannot exactly say, but it's from around say 6 lakhs to sometimes it's around 25 lakhs.
It depends
in the
on
range.
the distance as well. Okay, fine.
Yes, distance as well.
So you also mentioned that the other product you have is the Medilane Healthcare card, which is you are going to convert it into India card in the near future.
Yes, India Health Card.
So what exactly is the card? Can you just explain it? Because there are a lot of card available in the market. Government is providing some Ayushman Bharat card.
Yeah.
So what is difference between the Ayushman Bharat card and your card and normal medical state government has scheme card? So what is the difference between all of these?
So why we rebrand India Health Card is that our mission is to reach every Indian. That's only the reason why. We don't want to focus for Manipur or Northeast. We want to be the for Pan India. That is a reason why we call this India Health Card. And this is like a loyalty card. This is not like a discount. I mean, it's like a insurance card. It's just a say, for example, Prime Minister Health Card, or like state specific Chief Minister Health Card, and all the things are like it's a health insurance card. But our card is a loyalty card. It's a discount card. Say, for example, a person is went to the particular like hospital, and one another thing is that this Prime Minister or like a particular like state card is but for the particular section of the society. For example, if you are like belong to the BPL, you are able to enroll for that. But if you are like middle class family, you are not have an option for enrollment for that. It's for everyone, and this can be applied. And this is there is no restriction whether you belong to the BPL or APL or whatever. So you can apply. At the same time, this card can get concession, instantaneous concession whenever you use for the medical treatment, hospitals, diagnostic, dental, eye care, and even for restaurants.
Healthcare
and our like all that is in our networks. So what this is normally India Health Card. And we are in coming years, we have in coming years, we are planning to provide emergency medical loans for the India Health Card holders. Yeah, this is what we are planning. Yeah. So
it's a type of just to cover medical bills for the patients, as well as to provide additional financial benefit to the patients to do for the healthcare needs as well, right? So
yes. They got a concession.
Yeah, they got a concession. I also, as I went through your website as well, because before doing the interview, I did some research on your company, and I found that you also in the field of medical tourism as well, right?
Yes, we do.
So are you in the medical tourism as a consultant or as a service provider?
See, India Health Card is just not a card, it's a mobile app.
Right.
You can see that this is a mobile app where we integrate medical tourism service. So for example, a person want to go to the particular hospital in Delhi or in Guwahati or in like Mumbai. We listed the hospital. We provide not only for the hospital, nearby like hotels, and we incorporate. So because someone want to go for treatment in Delhi, he or she need to know who is the doctor they're going to treat, what is the history, and how much is the cost. And before going there, they can even need to talk to the doctor because of they just want to know. And at the same time, if they are confident enough, emergency medical treatment, mostly people usually go there. For example, say for example, IVF treatment in Delhi. So people used to go there. It is not like one-time visit. They have to stay for 3 months, 6 months. Absolutely. So for staying also, they need to find, for example, if you want to see search a room, it's not like a common room, because they prefer the first floor or ground floor, because there's a lot of like patient-friendly environment. Right. So that kind of the services is integrated. It is in mobile app as India Health Card app. India Health Card app is an app. It's not only for the card. The card is only one part of the service, and we are providing like a online doctor consultation in the future. We are going to like this is medical tourism is integrated, and not only that, we are providing medical loan facility. Right. When this is all set up. So this is what we do in India Health Card app. So it's a you have make a package out of the card. So a lot of features have been provided in the card as well, right? This is just a part of the like a small service.
Small
and
service.
other services are there. Yeah, this is app in app
App.
based. Even
Okay.
you can in the health card you can download the mobile app, the health card
Right.
app
Right.
from Google
Right.
Play Store. You can see
Mm.
all other services there. Yeah.
Okay. Wonderful. So as I went through the website as well, you mentioned there 10,000
Mhm.
cards have been distributed so far, or you have more cards to be distributed in the state itself?
Yes, yes. Not only for Manipur. This is for like pan India, and we are
Mhm.
expanding. And
Mhm.
yes, we started from Manipur, and the maximum of our cardholders are from Manipur. And
Right.
now we are expanding. Right now, we have like a one. Previously, we had our card is a chargeable one, and we
Mhm.
charges a very nominal fee per
Okay.
person per
Okay.
year. It's
Mhm.
only like a 600 rupees or 499 rupees, or we are giving discount. And we are planning to give around others integrated service. This will be increasing very soon, around 999. And where right now it's a very
Right.
for the listeners or for all the podcast listener, this card we are
Mhm.
providing for absolutely for free, and they can use the code. We are have
Mhm.
been releasing the code for that, and they can this is only for 3 months, like where we
Mhm.
are launching for
Mhm.
other state. We are providing for free. You can download the app, you can access the card. It's like freemium model. They can use
Okay.
for next 3 months, and after that,
Right.
if they feel that this is good enough, then they can be paid members. Yes.
Wonderful. Wonderful. Right. So let's come back to the journey of starting the startup,
Yes, yes.
Medilane. So are you the
Yes.
lone founder, or you have some co-founder along with you?
Yeah, I have a co-founder.
Okay.
Her name is Dr. Pinky, and we
Okay.
co-founded this company together.
Okay. So you both are from the same medical background, right? Great.
Yes, yes, yes.
So
Yes, we do.
just want to know very specific questions. When you started this particular company, was it a boot funding, or you got some venture capital angel funding from somebody or some organization?
Yeah, as of now, we have raised like from friends and family, a
Okay.
few like rounds and a few like seed funds, and at the same time, we also got a funding from Manipur Startup Fund,
Right.
and we are looking to raise fund for India Health Card specifically
Mhm.
for expansion. Yes, this is what as of now. Yeah.
And in terms of profit, are you in the process of earning profit, or are you still in the means in the same base level?
Yeah, we are profitable from the first year itself,
Okay.
and but we want to expand more. Yes.
Mhm. So you will be looking for more investment as well as to increase your domain, right?
Yes, 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 yes.
Okay. One more questions I have regarding this.
Mhm.
When when you started this particular healthcare sector, because I know you are from
Mhm.
the healthcare domain, because obviously your inclination is towards the healthcare domain. So
Mhm.
why only these selective services, just like ambulance and health card?
Mhm.
Didn't
Mhm.
you didn't find other areas as well in the healthcare segment where you can also venture in, apart from these two? What are the areas you could have
Yeah,
ventured
and
in?
like anything you
Like,
want to like
no, it's
give example? Yeah.
just
Yeah.
like providing tele telemedicine services like that,
Okay.
or some type of tech-based solutions. I'm going to say that health
Okay.
tech, because you are mainly in the field of providing core
Mhm.
medical services. I understand these are core
Mhm.
medical services,
Mhm.
but not specifically in health tech as well. So did
Mhm.
you don't have I think you might have done some brainstorming before and entering the business. I
Okay.
understand, but still you could
Mhm.
have, I think, those are areas you could have also tried. That was my question actually.
Yes, yes. During the COVID time, we provide telemedicine service, and
Okay.
we serve more than around 6,000 patients during the COVID time, and for like online consultation service.
Right.
And right now, like online doctor consultation, that telemedicine service, yes, there's a requirement for that, but people love to visit hospital, and that's for medical like serious consultation. Yes, there are
Mhm.
some consultation people used to do for like telemedicine. And
Mhm.
yes, the infrastructure is now ready. And in this India Health Card app, the telemedicine service is there. And
Okay.
Yes, you rightly mentioned that most of our service, our the activities are in the service space, and that's not a tech model, and that's not much scalable model. That's why we focus our energy, and we focus our we shift our focus from ambulance expansion of ambulance and home care to India Health Card and medical tourism service and digital services, because this will be the more scalable model.
Yes,
And
yes.
because we want to serve more people, that's why
More.
this is India Health Card is an app. It's not a physical,
Right.
I mean,
Right.
it's a card. It's an
Right.
India Health Card app. This is an app, and you can
Right.
download the app and you can get the most of the service like medical, like say for example, the one part, and India because online doctor consultation is also like it's a area like its importance is now growing, and the medical tourism is another part, because we want to focus on domestic medical tourism.
Right.
Because the medical, people has a tendency to move from one place to another for medical treatment for the better care, but
Right.
all that necessary informations, all that support, all that guidance, and everything is not that much easily available. That's why. And another service we want to add is that medical loan facility. Because someone went for the medical like treatment, normally people
Right.
get loan for the easily loan for the say for buying a house, or like for a car and other services, or for
Right.
education, but why not for health? So that's
Absolutely.
why, yeah, if health is very important for the patient.
Yes.
If
Yes.
health is
Yes.
good, he
Of
can
course.
repay the loan for the car
Exactly.
and other
Exactly.
things. So
No, that's
we are,
wonderful.
yeah,
That's wonderful.
we want to
So,
like, otherwise, yeah, please.
regarding the medical tourism sector, because
Mm-hmm.
I have also
Mm-hmm.
done some research on this particular field. I found that some of the states
Yes.
in India are very much in the front run, or they are in the topmost in terms of providing medical tourism services, just like state of Tamil
Yes.
Nadu, state of
Yes.
Karnataka,
Yes.
and Telangana
Yes.
as well. Because of course there are a lot of super specialist hospital available there. They have
Okay.
those technology available. But I want to understand what is the
Mm-hmm.
situation of medical tourism in the state of Manipur, not only, but in the entire region of Northeast, including
Okay.
7 states, maybe Assam,
Yeah.
Sikkim, Arunachal Pradesh,
Mm-hmm.
Nagaland, Manipur, and Mizoram and Tripura as well. So, what is the
Mm-hmm.
situation there? And what do you think?
Okay.
My next question, the subsequent question will be, what do you think? What are the areas the government should do, as well as the entrepreneur, specifically the healthcare people should do, so that the area can become a medical tourism hub in near future, not only for the
Mm-hmm.
India, but also for the
Mm-hmm.
ASEAN region, because in you can understand that we have, it's a border state, right? We have seven ASEAN countries joining the entire Northeast. So obviously they can
Yes.
also
Yes.
provide those services to those people as well. So what are the
Yes.
areas?
Exactly.
What is the take? What is thought for this actually?
Yeah. Actually, medical tourism, Northeast has a very good scope for the medical tourism, and Manipur is a neighboring country for like connecting country for Asians, and has a better advantage. But because of this crisis, it slowed down. Otherwise, Manipur, like in like for example, particularly Caesar Hospital in Rajmahal City, they attract a lot of medical like patients from Myanmar and the neighboring country Myanmar. Because going there in Thailand, the cost is much higher, and coming in
Absolutely.
Manipur is the cost is much cheaper. So
Cheaper.
why people
Yeah.
usually go for medical tourism is that because one of the factors is the cost, another factor is about the better facility,
Better
and that is
facility.
why. And now for like when we see for entire Northeast, now the like say Manipur, I can say that the maximum people their first choice is to become a doctor. So there are numerous doctors in Manipur,
Right.
and
Right.
at the same time, yeah, and second highest, maybe second highest in the Northeast. Maybe Assam, because of the population size, they may be the highest one.
Right.
And now even doctors from Manipur are now shifting to the Guwahati and set up hospitals. And like one of the
Absolutely.
examples, like Rahman Hospital in Guwahati, that he is
Yeah.
originally from Manipur. And
Right.
this is how now the Guwahati become hub for medical treatment in the for entire Northeast. Is my perspective. And many people from neighboring state like say Nagaland, Arunachal Pradesh, and Mizoram and Tripura, they are moving from Manipur to the Guwahati for the medical treatment, especially like other Sikkim, like Arunachal, Mizoram, and like even from Manipur,
Right.
Nagaland. people they're coming for the medical treatment, and not only for the Manipur, say for example, maybe from Nepal or many other country, neighboring country also may be moving here. So this is medical tourism is an area where we can focus, because say for India, when we say for India, medical tourism is also contributing a lot. And many other from country like African countries, especially from Afghans, they are moving here for the medical treatments. This is I can say this is a growing business, and contributing for the nation. Yeah.
It's because the cost factor, as well as the technology, as well as the quality of services that India is providing in comparison to rest of the other part of the world, maybe in Europe or US as well. That's one thing.
For Europe, Europe and other people are coming India because of the cost factor, especially.
Cost factor, yes. Cost factor, as well as the insurance is one of the main reason, actually. They need insurance.
And waiting time for them.
Waiting time is
the suit. Yes. For India, you don't have much waiting time for the say appointment for a dentist. They have to wait for 15 days. But in India, you can find dentists anywhere.
Lot of days.
Yeah.
Okay, great. Yes. That's right. And moreover, their quality as well. It's not that we have numbers, we don't have quality. We have quality as well. Those latest technology available with us, and latest treatment facilities available. That's really help us. And one more, in terms of medical tourism, as I mentioned, that what do you think right now, the situation in the Northeast in terms of medical tourism? Is it government is doing some focus on? Because what I found that, because it's my take, I'm not sure exactly, I'm sure I'm right or not, but I found that since Northeast is a region which is purely a green region. One is the green cover, as well as it's a hill area. You can't set up the those industries as well, but service sector can do a lot of work in this particular region. And healthcare is one of the biggest, one of the topmost service sector. I can understand that can make a lot of difference. So what is the policy of the regional state governments, each states doing in terms of setting up, making the entire region a healthcare hub or service hub for the entire India, and for the global as well?
Yeah, actually, government should look, more seriously here, because as you rightly mentioned that our Northeast is not the place for industries doing, and tourism is another sector where we need to be focus more, and among that tourism, medical tourism is one, where we can focus because of the costs, and other facilities providing here, and the government should be. And also, I believe that the government has tourism, medical tourism, a policy, and I believe that government is also working for their base. But we feel that say for example, if the area is not that much prevalent for particular industry, another industry is thriving, so we should be focusing more in the particular industry, which is more potential in the future. That's what I feel.
Right. Just like Bangalore has been focused for IT sector.
Yes.
The entire Northeast can become a. No, I'm not sure if the healthcare, but other sector as well, but specifically the service sector. That's right. According to the geographical condition and ecosystem, we can develop.
Yes. And say for example, for manpower, especially for the nursing care, entire India, you will find the nurses from Northeast more prevalently, and especially from Manipur and Assam. And you'll find every hospital you go, you'll find nurses from Northeast, and especially from Manipur. Previously, it was from nurses from Kerala, but now it is shifted. So that's why, not only for medical education, especially for nursing care, there's a huge potential in Northeast, because people from Northeast are very smiling people. They're very warm people. They're welcoming people. When we talk about the caring of the patient, you cannot, frowning face is not suitable. Absolutely. And smiling face and caring face is more suitable for that. It's not, I don't mean for any other things. It's not about that, but suitable for the particular service, like industry service and especially caring. That's why I feel that. And moreover, this is a huge scope in Northeast.
Moreover, I think there is the thing that they have no language barrier as well, because most of the nurses in Northeast can speak dual languages. Local language as well as the English one of the
Yes.
official language. And I think most of the
Yeah.
most of the people who are coming to the medical, they can understand English as a part because they can easily can. That's one thing as well. And at
Yeah.
last, I want to ask a couple of questions regarding the startup ecosystem in Northeast. See, you started the company in 2017, right? After that, I think a lot of change, right? In the northern
Yes.
part of India regarding the startup ecosystem.
Mhm.
How do you find the change? What are the changes you have encountered in couple of years since
Yes,
2017?
Yeah, actually, when after we started, COVID come and everything is now locked down. We cannot do anything. But now after that, we are recovering from the COVID. There is a lot of like incubation centers are starting. And when we just started, there's no much incubation center in the Northeast. But after
Right.
that, there is a NACE is there in Guwahati, and IIT Guwahati is taking a very initiative about promoting entrepreneurship. And every state has started about entrepreneurship program. And this is like it's improving, I can say. And a lot of entrepreneurship events are going on. And this is entrepreneurship is not a new words for many people now, and it's become like a
Right.
household name, household word. And
Just
people say, for example, I usually heard about when someone like result for the class 10 and 12 is announced, and any
right.
of the student toppers are saying that I want to become an entrepreneur. And many people ask that. I mean, what do you want to do in future, and what do you want to become in the future? So many people say, I want to become an IAS officer, I want to become a doctor, engineer, lawyer.
Right.
That is their
Right.
aspiration. But I'm looking, is any person from like top ranker want to become an entrepreneur?
Entrepreneur.
And this is what I'm looking. But this is time in changing. Why I'm saying
Yeah,
this?
of course. Yeah.
Yeah. Yes, please.
So that's the one reason is that entrepreneurship is not in the thought of the northern people till now. I'm not sure in future, but till now. But eventually, because see, the world is changing, everyone is changing. So obviously, you can through the social media and everything as a government scheme as well. I think people are finding this particular area as a means to improve their economic condition, as well as the not only for the personal and economic condition, but also for the entire region as well, providing jobs and everything.
Yes.
So that's the thing. There's a reason I think most of the people are interested in becoming an entrepreneur.
Yeah, actually, there's one thing I can say about entrepreneur, and many people love business, doing business.
Absolutely.
And whenever they do business, they say they are entrepreneurs. But there is a difference between a businessman and entrepreneur. So entrepreneur thinks about it. That's a big difference. So entrepreneurship, when he start entrepreneurship, he may not be, profitable. He may not be like have nothing, but he is looking for the future prospect, and he's looking for the solving of big problems. And that's a businessman. It's like traders. And I sell this, I got this is my money, and that's a concept. But the entrepreneurship is not an easy route. Okay. It's not that quite not easy. It's a route, but it's a tough one. But it is rightly mentioned that it's not for everyone. Entrepreneurship is not, and it's sometimes a lonely journey, and taking a huge amount of risks, and it's unknown territory most of the time they're going. And most of our services, it was not never before there. And we are like a first mover means you don't have anything to be tested, anything to be the compare.
Right.
Have the aspiration to become an entrepreneur.
Right.
That's why they're going.
So I think according to you, it's improving in Northeast right now.
Yes, it's improving.
It's improving. And people are making effort to become an entrepreneur with not only in the healthcare, but the different sectors. Maybe health tech, agri-tech, and everything. Right. Great. So it's being a night. Yeah.
One more thing I would like to add. So if any like startup from Northeast, if if I now become a unicorn, and then more entrepreneur, more big companies will be coming up from Northeast also. So because this is because aspiration. Yeah. Aspiration, and then it will inspire a person. Like, for example, why Silicon Valley companies are like big companies are coming from Silicon Valley or from India, like Delhi, Gurgaon, and like Bangalore and They have an inspiration, and that's why. So we need to, like from Northeast also, we need to be working and with ideas, not only for local centric and specific like state centric or local area centric, but a bigger vision. So, when we start for a Medilane ambulance, we want to be the largest ambulance in Manipur. Then we become the largest ambulance. Then what? And when we started to become home nursing care, we want to become the largest home nursing care service in state Manipur. And we become next what? Because our aspiration finished there. So that is why we changed our perspective. We want to become the largest, like a medical tourism, at the same time, patient-centric healthcare service, like a enabler for the entire nation. That's why we call our product name is the India Health Card app. Our vision is now becoming bigger, not only only for Northeast or Manipur. That's why from day one, if any to start a business, we should have a bigger dreams. There's nothing wrong with having a bigger dreams. It doesn't cost you anything. Dream doesn't cost you anything, but the size of your work will determine by the dream you make. So if you don't dream it, you cannot do anything beyond your dream, beyond your imagination. So at least I would like to suggest from this is my after learning and experiencing from my journey, have a big dreams. And yes, thank you.
So this is the you want to tell this future upcoming entrepreneur that they should also focus on.
Absolutely.
They should strive more because it's just a start. It's just a start. We are still in the in the budding stage, so it will take some time. But obviously, they should do something in this particular field. Just like people like if they get inspiration from people like you and other people, obviously they will also jump in, and obviously ecosystem will develop, and near future the entire area will become a startup hub for the in 10 years from now, 20 years from now, it will become a hub. That's a wonderful thing.
Why not?
So before we conclude, I want to ask a couple of questions to you. It's very small questions. What's your favorite book?
Actually, when I started, I used to love a lot of non-fiction books, especially like self-help books. And most of the favorite books are like first book I have read is about Rich Dad and Poor Dad. And I really love that book. So because this changes my perspective from employer to the like employee and employee mindset is there rightly showing there. And now I'm more aligned with the spiritual books now. Okay. I used to read books related with the spirituals. And now it's like I used to read Bhagavad Gita and many other books, not that book with the original books, because I read which is like a My Gita for the Devdutt Patnaik's and his books I'm now reading, and this is wonderful books, learning a lot from there. And now I'm more interested about the power of subconscious mind, our mind especially, and like habits, formations, all the things. And by the way, I'm a certified soft skill trainer, and I'm certified healer also. I practice healing practices apart from my medical practices. And every night we have a session from like 8:30 to 9:30, sometimes 10:10. We have healing sessions because, I use the technology a lot. I use to teach to the through Zoom platform. I can connect with the thousands of people there. And I used to teach about soft skill, about communication skill, negotiation skill, time management, goal setting skills, all that things. And because I feel that, knowledge needs to be spread. That's why.
Thank you very much, Dr. Dayanand, for your time.
Yeah.
And hope we enjoy a lot of, we learn a lot of things from you, and hope you enjoy the conversation as well. And we will have future conversation with you with time. I understand this is just a first series of interview. So probably in near future, when you make a lot of achievements, you take more of achievements, we come down and do a physical interview with you. Obviously, this is a teleconference interview. So I would really appreciate your work. And thank you very much for joining us. So friends, I hope you enjoy the entire conversation and listen to the guest. We'll invite such individuals in nearest future who are doing great in their respective field in subsequent series. Please stay tuned to us and try to motivate us with your comments. Good day and gracias.